Hi, good people. Today we are looking at convulsions. How do we treat convulsions? Just a side note, this content is for educational purposes. So if your child develops something like this, kindly seek medical attention from the nearest hospital or facility. One, what do we do if a child is brought in convulsing? With the ABCD one, we need to check at the positioning. Lateral positioning is always the preferred one. Then we suction if there is any sort of indication. Two, we need to do supplemental oxygen. Why? Because when one is convulsing, we've always talked about the abnormal electrical activities and this all other things. So we are risking the aspect of hypoxia, and this can damage the brain much more. That's why we do supplemental oxygen. Three, we need to check temperature. We are looking at children with the aspect of febrile and febrile. So there are instances when the temperatures are too high, they will always predispose an infant to this aspect of convulsing. So if the temperatures are high, we either expose the child. Two, the mother can wipe the child. Three, if it's that too high, then we can opt for medical management so as to control that aspect of temperature. Then let's say we've done this and the child is still convulsing. We need also to look at the RBS because hypoglycemia can also bring this aspect of conversion. So if it's low, we do the supplemental. We use the dextrose 10%, which is 5 mils per kg. Then we administer that. So let's say we've done all this, but our child is still convulsing. What do we do next? At this point, we need now to start the medical management because we are trying to prevent the seizure or the convulsion because this is what will now cause more harm, mainly to the baby's brain. So we do diazepam. If we are unable to access the IV route, we can go for rectal, which will use 0.5 mg per kg. But if you can access the IV route, we do 0.3 mg per kg. Then after that, we need to observe the child. Then let's say, if the child is still convulsing after 5 minutes, once we have given the first dose of diazepam, we can give the second dose of diazepam. Then we need to continue also giving that oxygen. Then we also need to check the airway because they're always at risk of blockage. Then while we are giving this diazepam, we are now continuing to investigate what might be the problem. Let's say we have given the second dose, but the child is still convulsing 5 minutes after the second dose. What do we do? At this point, we need now to go to the other class of these types of drugs, which is now phenobarbitone. So we give a loading dose of 15 mg per kg, that is for intramuscular injection. Then we maintain it with 2.5 mg per kg OD for 48 hours. Then we need to review. So at this point, we are trying just to control the convulsions, but we need also to investigate and we need to treat the cause. If you're unable, kindly refer appropriately. Then just a side note, do not give more than 2 doses of diazepam in 24 hours. Once phenobarbitone is always used. Then 2, if the child is non-epileptic, do not give the loading dose of phenobarbitone. Just do the maintenance. And that's all about convulsions. I don't know if you've encountered such a thing. Probably you can share with us.